I had to save my son from psychosis and the system that was supposed to help him. I'm going to share the story time, even if it means that I don't get a book deal, because I'm going to give away some spoilers. The thing is, it's just too important of a story not to tell. And so I'm going to tell it. People need to know the signs and they need to know how to navigate a medical system that's often a minefield. So Issa was a really smart kid. People would even ask me, like, what did you do to raise him so well? He's so sweet and well-mannered, and he's just always been a really wonderful kid. Now, things started to change when COVID was about to happen and the world was about to shut down. Issa started having a lot of anxiety, and he was having phobias of like random things like bees and going outside and seeing people, and that was bizarre, but everyone just kind of wrote it off to, oh, it's, COVID fears, lockdowns. Like it would be a surprise if he wasn't anxious. And so we just kind of wrote it off. We're like, okay, that's probably what it is. But we got him on some Zoloft or Prozac to help with his anxiety, because there came a day where he was like, Mama, I can't live like this. A few days into starting that medication, he started making this weird, like whining sound like a puppy. And we'd ask him, like me and my husband would be like, why are you making that sound? Why do you keep doing that? And he would say, I don't know. I can't help it. Like I have to just do it. And we were like, well, stop. It's annoying. And he was just like, I can't. So anyway, we're just like, all right, he's 10. He's going through a phase. Kids do weird things. Around the same time, he started becoming really hyperactive. He's just kind of bouncing off the walls, which was really weird for him because he was always a very docile, kind of like a little professor, just really, liked to read, and he would be drawing maps all day. So when he started jumping off of furniture and just like panting and things, we were like, another sign. We're like, that's super weird, but I mean, maybe it's a boyish phase. Around that same time, he started to wet the bed. And that was something that really got my attention. I was like, what is going on here? Like, he's never been a bedwetter. He's been potty trained, since he was like 3. We took him to the pediatrician, and the pediatrician said, well, surprisingly, it's very common for especially boys up to the age of 12 to wet the bed. It's not uncommon, right? So we took him back and we're like, okay, I guess that's just another phase he's going through. He was soaking through sheets and clothes multiple times a night, and this was weeks. A few months into this, we took him to a neurologist who diagnosed him with Tourette's syndrome. And I remember being devastated because Tourette's is something that is a lifelong disorder that you have to live with and learn to manage. And so my husband immediately, a therapist to help him learn how to manage his tics. It was really impossible because every day the tics were just growing and they were loud and shrieking, and it was hard to be around him, if I'm being honest. So one day, it was a nice day in January, and we decided to go out as a family. When I got home, I was preparing dinner, and Issa was just kind of sitting there looking off. And I asked him if he was okay, and he didn't respond. And then he was facing the TV, but he wasn't watching the TV. It was off. And so I'm like, what are you doing? And he didn't respond. And he gave me this look, and I thought he was giving me attitude. So I was like, Issa, like, go find something to do. Like, have you done your homework? Go log on, check if you have homework. And he didn't say anything. He got up, he left, came back and sat back down in the living room and just kind of stared off again. And I was just kind of curious, like, what is he doing? He's not, So I asked him again. I'm like, are you okay? And he just looks at me, but he kind of looked past me. And I'm thinking, is his blood sugar low? Like, is he having some sort of episode? So I tell him to come sit down and eat something. And he does quietly. And he's still just staring off, not looking at anything, not focusing on anything. And normally this kid is sprawled on the floor with markers on his whiteboard, and he's drawing a country or, some sort of flag. And he's not doing anything. So I go and I sit next to him and I say, what are you feeling? You don't look right to me. And he looks up at me and he says, can you say a few words? And I'm thinking, this kid is super articulate. He's brilliant. Like, what do you mean? Can you say a few words? Like what do you mean? So he's just looking at me kind of perplexed. And so I start saying words. I'm like, are you hungry? Are you thirsty? Are you angry? Are you confused? And he stops me and he goes, that one. I'm like, you're confused. And he's like, Yeah. It's like, okay, I don't know what to do with that information. Like as a mom, you can solve a lot of problems, but like, what do you do when your kid tells you that he's confused? So I called the neurologist's office. It was late. It was like 9:30. And she calls me back and I tell her that he's just kind of acting weird and I don't know how to explain it. He's saying he's confused. I don't know what to make of it. He has recently been diagnosed with Tourette's, but other than that, like he's a healthy kid. I don't really know. The doctor on call says, well, I don't know, mom. I'm not there. You're the mom. What do you think? Do you think he should go to the ER? And I'm like, I don't know. I guess I'll just wait and see. So anyway, I hang up with her. It was pretty unhelpful. And in that much time, like my husband comes out and he brings out the hamster to kind of cheer him up. And I, because I told him he's not acting right. Can you just come see what you think about it? And he brings out the hamster and Isa smiles at the hamster kind of weakly, but he doesn't engage. He doesn't interact. He's just kind of off. And so then I say, okay, you know what, Isa, I'm gonna take you in. I'm gonna take you to the emergency room. And Issa says, yeah, I wanna go. And now I'm trying to judge. This is a 10-year-old. The doctor's not concerned. Maybe he's just sleepy, tired, I don't know. And so I'm trying to convince him, there's gonna be needles. Are you really sure you are feeling that unwell? And he stays quiet. And moments later, he says to me, can you hurry up, please? I need to go to the doctor. And that's when I realized, okay, he's really serious. I say, okay, get up, put on your socks, let's go. And he just stares at me kind of dead behind the eyes and he goes, I can't. When I realize that he can't get up, I call out to my husband and I'm like, we gotta go now. Something is really wrong. And by the time my husband comes out, he's lying on the ground and he can't move. He's pretty limp. So he throws him over his shoulder. I grab some bags. I grab our younger daughter, Isla, who was sleeping at the time, and we rush off to the closest emergency room. Once we get there, they evaluate him, and by that time, he is having a hard time raising his arms as well. They say that he needs to go to the closest children's hospital. They put him in an ambulance, and we go to the children's hospital. I'm thinking this whole time that problem with his legs and his arms, like maybe it's like he pinched a nerve in his spine, or I'm thinking it's muscular, and he's just tired. Because there was no way in my mind that something catastrophic was unfolding. Lisa gets admitted to the children's hospital that night. Other than feeling slightly confused and not being able to walk, he is himself. He's sweet and curious and kind and everything that we love about him. The next morning, apparently the same doctor that I had called to ask if we need to go to the ER was the doctor doing rounds that morning. She evaluates Isa. Her and a nurse or like a physical therapist or someone has Isa walk, and she looks at the person that's with her and goes, did you notice his toes? And I'm looking at his toes and his toes are kind of curled in and he's having a really hard time walking. And I'm looking at their faces like, what do you mean? What does that mean? What do the toes mean? But they don't say anything and I don't ask because I'm a nobody. I'm just a mom. If something serious was going on, of course, they would be the ones who would determine that. So she tells me, we should get an MRI, but our MRI techs aren't here because it's the weekend. It was Friday night. They won't be here until Monday. So we wait. In the 2 days that we were waiting, Isa started to babble. His speech was declining. Yeah? Okay, let's write it down. His personality was still intact, but there would be phases where he would speak kind of like a baby or like have gibberish. So I started giving him like his little writing board that he always carried around with him and he could communicate. And what he communicated was, I don't feel right. The next day, his condition continued to decline and he was trying to talk, but he was completely unable to speak. I handed him his board and handed it back to me, and my heart just sank because it was gibberish. It was just circles and lines, and there wasn't even a letter that was discernible. Finally, Monday rolls around. I give him a kiss on the head, and the anesthesiologist says, don't worry, Mom, we'll take a really good care of him. We'll bring him right back to you. And what I didn't know at the time was that was the last time I would see Isa the way that he was.
Oh yeah, I forgot to tell you. If you stretch that material, then it goes the reverse.
When he came out of MRI, he was asleep. He woke up in a complete state of psychosis. And by that, I mean he was screaming about the wall should be a perfect right angle, and it's not. That he's a triangle, he's not a square. Something about wallabies. He doesn't want to be purple. He was just shouting completely incoherent statements. And at first, I giggled a little bit because I thought it was the anesthesia. I thought he was coming off of anesthesia. And after about an hour, I called the nurse and I said, he doesn't seem to be coming out of the anesthesia. Like, I know people can be goofy for a while, but he's been going like this for an hour and he's screaming and he looks afraid. He's not coming back. And they said, well, I'll let the doctor know. Everyone reacts differently to anesthesia. So I just sat tight. He says MRI, his CSF, his EEG, all came back normal. So ultimately the doctors, 2 of them, decided this is something called functional neurological disorder. Essentially it's in his head. He's stressed out. And the doctor said, has he been really stressed with school and things? And I was like, he's been anxious. And so they determined he had functional neurological disorder. A physical therapist came in to help him, learn how to walk again. And so she was walking and she came back and she told me, well, Mom, with functional neurological disorder, kids will catch them if I let them fall, because their bodies kind of instinctively jump in and save themselves. And I'm waiting for her to tell me how it went with Isa. And she kind of comes close into me and she says, Isa caught himself a couple times. And I said, okay. And then she kind of pauses and says, but he didn't catch himself every time. And I'm kind of just waiting, staring like, why are you telling me this? Isn't this something the doctor should know? She doesn't tell the doctor and she leaves. After 7 days in the hospital, all the tests have been done. We are discharged to go home with a functional neurological disorder diagnosis. And we are supposed to follow up with the functional neurological disorder expert whose first availability is not for 4 weeks. So we take Isa home. He can't walk. He is either quiet or not making any sense. Sometimes he was coherent. I got him in bed, surrounded him with pillows, and put him in the middle of the bed so he wouldn't fall over, because at this point it seemed like his brain was shutting down like every few seconds, and he would go into a trance-like state and his head would drop. And these head drops, we can't call them seizures because EEGs were normal, so we were just calling them head drops and trance-like states. I put a morsel of food in his mouth. He hadn't eaten in forever, and he would chew, but before he could swallow, his head dropped. And I panicked and stuck my finger in his mouth and pulled the food out before he would choke on it. Fahad was on the phone with the head of neurology at the Children's Hospital of Philadelphia. He happened to be the brother-in-law of one of Fahad's colleagues. He explained everything that was happening, and he said, this sounds much too severe to be functional neurological disorder. Fahad's doing his research, trying to figure out, making plans like, how do we get there? It was 4 hours away. While he's doing that, Isa said, Mama, thirsty. He's not speaking in complete sentences. I give him a sip of water, and I'll never forget the look on his face. He just stops and he has this horrified look in his eyes. Then I hear a gurgling sound. He was not being able to swallow the water. He was going to choke on it. I jumped into action and I pulled his head forward so the water would leak out of his mouth. And it was then that something just changed inside of me, and I went scorched earth. I scooped him up. I grabbed a suitcase. I told Fahad, we are going to the hospital and we're going now. So the drive was 4 hours long. I sat behind Isa. The seat was reclined. He was in the passenger seat, and I held his head because he didn't have any control of his own head. It would fall forward if the car braked or anything. So I cradled his head like a little Fabergé egg for 4 hours. I perched at the edge of my seat, and Fahad just drove incredibly fast that nobody spoke. It was just complete silence in the car for 4 straight hours. When we got to the hospital, just asked me, oh, what's going on today? And there was a woman in scrubs sitting behind her watching Isa, and hopped off the counter, and Isa's head is dropping every few seconds. And I said, yeah, they couldn't find anything wrong with him. She grabs the wheelchair handles and she just books it down the hallway, and she takes him into a room where a bunch of people jump into action, and they get him admitted into a room and immediately hook him up to a 24-hour EEG. They keep him there for 4 days under observation, and they sent his blood work out to the Mayo Clinic. He's negative for everything. The nurse that was standing there, he was watching Isa. And on the day that we were going to leave, he leans into me and he says, "Have you seen Brain on Fire?" I had seen Brain on Fire. And I remember thinking at the time that I watched the movie, I was really moved by it, but I thought, oh my God, it's just so sad the things that people go through. And never would I have imagined that years later I would be the mother of the person in that bed. So we're sent home from the second hospital and there are still no answers. In the meantime, Fahad had contacted a psychiatrist that the first hospital had recommended. They were convinced it was a psychiatric condition. The psychiatrist went through the story with Fahad. When we got back home, she called me later that night. It was 10 p.m. I still remember, because what doctor calls you at 10 p.m.? But she called and she asked me to run through the story again. Then after an hour on the phone with her, she says, "I think that your son has something called PANDAS. That stands for Pediatric Acute Onset Neuropsychiatric Syndrome Associated with Strep." She wanted Isa to be put on antibiotics immediately. She called our pediatrician that very same night and asked him to put in the orders so we could pick them up in the morning. 24 hours after Isa was put on antibiotics, I remember he was sitting at the table. I was watching him from across the room and he looked at something. And by looked at something, I mean that his eyes had been vacant for 2 weeks now, and it looked like he was able to focus on something. He saw something. And immediately I thought, there's a spark. He's in there. At that point, I didn't know if we had lost him forever, if he was trapped in his body and we had to save him. So now I am fully convinced that this PANDAS thing is exactly what is happening with Isa, because he responded, at least in the tiniest way, to antibiotics. He had not responded to any of the other medications, the antipsychotics, even Ativan, CBD oil that the neurologist had tried weeks prior. He had been put on a slew of medications and had only continued to get worse until he was put on antibiotics. And that was the first time in weeks that I saw the tiniest glimmer of hope that my son was still in there. The next several weeks until the FND specialist appointment, I of course went down this rabbit hole of PANDAS, and I connected with so many other parents who had a Facebook group called PANDAS Parents, and they were so incredibly helpful. But it was so clear to me that these families were broken beyond repair. This disease, it shatters you. You are mourning the loss of a child that you are still responsible for taking care of 24 hours a day. That child has become a danger to themselves and others. They are unpredictable or complete psychiatric loss, and you are walking on eggshells. No one in the house is breathing. Up until that point, I did not know PANDAS was a controversial diagnosis. To me, a diagnosis is a diagnosis. If the symptoms fit and the treatment is helping, then I didn't understand what the problem was. We get to the functional neurological disorder doctor. I'm convinced Isa has PANDAS. We just need to find somebody who can help. Going to the FND doctor was just checking a box for me. I'm so glad that we went. That appointment was the first time in weeks of medical gaslighting and dismissal that somebody actually acknowledged what we were going through. Getting back to the functional neurological disorder doctor, he sees Isa for about 5 minutes. Isa at this point is hiding underneath the chair that I am sitting on. He is feral. If you've ever seen a feral scared animal, that was Isa. And this doctor says, I have to make a phone call. And he goes in the hallway and he makes a phone call for 10 minutes and he comes back and he says, Isa does not match the phenotype for FND. Basically, it was doctor speak for, this doesn't look like FND. And then he says, this is a biologic issue and I want you to see my colleague. She got us in to see her at 7 a.m. the next morning, I think as a courtesy to the FND doctor who she respected. We see this neuroimmunologist virtually at 7 a.m. the next morning, and I walk her through everything, and she wants to start him on steroids. And so we put him on prednisone, but within the first day of being on prednisone, he became very agitated, and he was already so agitated and volatile that I was afraid of him getting worse. And so I wrote to the doctor and I said, look, he's worse on the steroids, so I don't want to continue. We stopped, and this was my mistake. It was my naivety and the fact that I just wasn't literate in immunology. The next several weeks, we are crazed looking for any doctor that will see Isa. Isa's condition is stabilized to some degree on antibiotics, but Dr. Rao wants him to take a bunch of other supplements which should reduce inflammation. I never understood how herbs and things like that could help with inflammation. I just didn't think that they were that powerful. I was a proponent of modern medicine up until that point. So I wanted to continue with antibiotics. Of course, I got the herbs and the supplements. We spent thousands. He was not improving dramatically on them. Like, I didn't want to see incremental improvement. I wanted my kid back. One day I found Isa laying on the floor, babbling like a baby. His tongue was waving out of his mouth and he was laughing, playing with a stuffed animal like an infant, and tears were running out of his eyes. And I just knelt down next to him and I started crying, and he could barely speak, but all he would say is, "Mama, no cry." Up until then, I had spent day and night researching what could possibly be wrong with my kid. I had lost 15 pounds by then. I wasn't sleeping. I had quit my job. And when I saw him in that condition, something snapped. And I scooped him up and I told my husband, "I am going to get Isa IVIG tonight, or you're going to have to come get me out of jail." By some miracle, the doctor on call that night was the neuroimmunologist we had seen weeks prior. She stared at Isa and just was like, "I don't know what to do with him. All of his tests are negative for any kind of encephalopathy." And she just sat there and stared, and I sat there and stared at him too. And then just as I looked at her and I said, "If it looks like autoimmune encephalitis, can you please, for the sake of my family, for my child, treat it like it is, because we're losing him." At that point, I knew what he needed was 2 grams per kilogram of IVIG administered over 2 days so that it could completely squash his body's immune response. A regular dose of IVIG would only trigger it. He needed a strong dose to really suppress his immune system that I knew was attacking his brain. The neuroimmunologist was quiet. She didn't say anything for a long time. She just kind of patted my hand and said, I'm so sorry about what you're going through." And she left. And so I was defeated. I remember just putting my head down next to Isa. He was incoherent, and I just sobbed, feeling like all hope was lost. A few moments later, a nurse came in, walking around the room kind of busy, and I asked her, what was going on, and she said, "Doctor wants to start IVIG tonight." And that was the beginning of getting Isa back. Within a few days of treatment, Isa was speaking again. He wasn't hiding in a closet.
I was not nervous.
He was answering doctors' questions. He was speaking to me again, and so he was getting better. We were released from the hospital, and a few weeks, he wasn't even close to baseline. But, he was not in an acute psychiatric crisis for a while, until 5 weeks later when Isa thought that he could fly and jumped off the stairs and chipped his 2 front teeth. I called the neuroimmunologist nurse immediately and I said, he's declining again. And she said, "Okay, I've spoken to a doctor. She wants you to bring him to the ER. We'll get a room ready for him." The next morning, there was a different neurologist doing rounds. He came in and saw Isa and he said, "I've been reviewing Isa's chart for a long time, and it's not that I don't believe in PANS. It's just that I think it's overdiagnosed." And I said, "Oh, okay." He looks at Isa's puppy, his puppy dog that he was holding, and he asks Isa, "Who's this?" And Isa doesn't respond, and he looks over at me because he's not responding to anyone right now. And I said, "Oh, well, he likes stuffed animals." And the doctor says to me, "Are you a cardiologist?" I was so confused by that. I took a step back and I said, "No, I work in marketing." And he goes, "Oh, I thought you were a cardiologist." And I'm very confused, but okay, maybe he's just kind of odd. He comes up to me and he says, "Mom, how do you expect your son to behave if you're going to reward him with a stuffed animal?" And I'm processing now, embarrassingly slow, but I'm processing what he's saying. Then he says to me, "He's really smart." And it clicks. I know exactly what he's saying. Then I look at him straight in the eye and I said, "He's smart. He's not psychic." I think it was clear to both of us at that point that the conversation was over. And so this doctor says, "All right, I think we're done here." And he turns and leaves. When I get home, I see that IVIG lot has been recalled. And I think, oh no, we were just in the hospital. I hope it's not the lot that Isa got. I'm going through my chart, looking at all of the clinical notes, and I come across his notes. I will never never forget, at the end of his notes, it says, although I cannot prove it at this time, medical child abuse should not be dismissed. I'm furious, and I'm like, who is this guy? How dare he say this about us? He spent all of 10 minutes with us. Why would he put that? I want this removed. I want this note taken out. I called the doctor's office and I talked to my neuroimmunologist nurse, and she says, look, we've already seen the note. You cannot have it erased. That's not how it works. The best we can do is bury it. When a medical child abuse accusation is made, that family is now under a microscope. We are trying to get IVIG approved. Our child clearly needs this medication. Accusations and allegations of medical child abuse is like getting the hospital's doors slammed shut in our faces with no other avenue. So Fahad hires a lawyer immediately. He's seeing the danger, I think, more clearly than I was. I was just offended. I didn't see how dangerous it was at the time till he, kind of got the lawyer on the phone and she's telling me about medical kidnapping, and basically she tells me, you need to shut up. You are the perfect case study for moms who get accused of medical child abuse or Munchausen by proxy, because you are articulate, you are well read, you are challenging a doctor's opinion, and you look like you're doctor shopping, and you are seeking medication for your child to get attention for yourself. I tell her our lives have fallen apart. I've left my job. My kid's not in school. Like, I'm doing nothing but caring for him full time. How can anyone want this? And she says, you need to stop talking, because every example of what you've given up is another example that they will bring up in court about all the ways in which you want to make his illness your entire story. She tells me I need to start playing dumb if I'm going to be smart about this. I need to mispronounce medical jargon, and even better, don't talk at all. Default to your husband, because there is a strong misogynistic kind of undercurrent to this Munchausen by proxy accusation.
I kind of knew something was off the day that we were discharged from the hospital after we got IVIG. But before I knew that doctor had accused me of medical abuse, I was waiting for my husband to come get us from the hospital, and I got a call from our neurologist, and it was from a number that I didn't know, and it was because she was calling from her personal cell phone from home. She was homesick that day. I found that really odd, because the follow-up calls of like, oh, I just wanted to make sure everything's going okay, those are usually from the nurse, and they're definitely not from home. When you're out sick. So I thought that was odd, but I kind of figured, she's an attentive doctor. Maybe she's just really wants to make sure everything went okay, because he said it was kind of a complicated case. So she says, I just wanted to see that everything went okay, or, was everything all right? And she goes, well, how were things with the doctor? And I said, honestly, I did not like him. He made me feel like I was on trial. I've never heard of a doctor speak disparagingly about another doctor. Mind you, this woman is like very stoic, and she scoffs and she goes, don't worry about him. He's just a headache doctor. And I thought that was very bizarre. I was like, she doesn't seem to like him very much. What I didn't know at the time is that in his write-up that he did, that she was already aware of, he had not only gone against the opinion of his superior, who was the FND specialist that said this is definitely not psychiatric, he went against our neurologist and said that she was wrong, and made this entire 3-page case for why they were wrong, and then ended it with the cherry on top that he thinks this is medical child abuse. Knowing now that there was some animosity between them, I wonder, was this internal politics? Was there an element of it at least? Was this retribution? Was this an attack on my neurologist? Was it political? I don't know. But what I do know is that it happens way more than any parent out there realizes. If you are a complex case, if they can't figure out what's wrong with you, if the biomarkers aren't there, if you may very well be accused of faking it. The other thing that I did not know that I think is super important for parents, and especially moms, to know is that when you speak, everything is on the record. So if you're not going through your clinical notes, you may not know what the doctor's saying about you. They are identifying who is saying what. They will identify, mom says this, mom says that. You're not just giving them symptoms. Mom says this, dad said that. In my case, there was even a number, mom is like F something something. Curious, I'm like, what does that even mean? I looked it up, like mom is exaggerating. If you've watched the videos that I've posted of Isa so far, you tell me if you think my description of him is an exaggeration. As a person who works in writing and marketing, to this day cannot articulate how devastating his symptoms were. When this doctor that accused me wrote up his notes, he very carefully chose his words, and he said, Mom produced a video claiming that I had put together this version of events I wanted to put on a show. The reason that I had created a video at all was because on the third day of Isa's hospital stay, Dr. Patel had said, I didn't know he was verbal. So I produce a video to show them, look, this is the boy that he was and this is who he is now. Do you see the difference? They used that as an example of me trying to create a narrative that didn't exist. So at this point, I've been accused of medical child abuse. My child is still in and out of psychosis, but the medical system is now my biggest threat. The lawyer is telling us you can never take him back. You have been flagged. There is a really good chance that they can call you in for a follow-up appointment and you never see your child again. She gives me an example of a mom who is dealing with exactly that. We are scared to death. And then I ask her, well, what if they accuse us of medical neglect if we don't take him to this follow-up appointment? It's been made clear that yes, he has this serious medical illness. If I don't take him to this follow-up appointment, are they going to say these parents are neglectful and take him anyway? Honestly, they could do that. And she doesn't have an answer. She's just telling us all of the worst case scenarios of what could happen based on the real life cases she's working on. We're having to decide between our child's safety and his sanity, which is crazy. We decide we're going to go to this follow-up appointment, just hope for the best. We cannot tell Isa what is happening because he is already paranoid. He's hallucinating. We can't trigger him with something scary like this because we don't know what he'll do with it. So he has no idea what's happening. The lawyer tells us if you're going to do this, if you're going to walk into the lion's den, you need to be alert. You need to also know that somebody from Child Protective Services could claim to be someone else. Keep your eyes open, stay close, and if things start feeling weird, get out of there. We're in the lobby. I sign Isa's name in at the front desk. It just kind of felt like I was signing my child's life over. They now know that we are here, and I don't know who's coming. I don't know if someone's coming. All I know is the people that could take my child know we are here. They call Isa's name. Fahad and I are holding Isa by one hand on each side tightly. We're just looking at each other, heart beating a mile a minute. And when we walk through the doors, the nurse introduces us to a man that we have never met before. He's wearing a badge. I can't see what that badge says. The badge is flipped over towards his body. I feel like I'm gonna pass out. This guy is from Child Protective Services, and this is it. This is like, do we run? Do we make a scene? What do we do? How do we save our child? He says, oh, I'm just gonna take Isa for an eye exam before he sees the doctor. Fahad and I look at each other. We have no idea what to do right now. Is this a ploy or is it just an eye exam? And we go, okay, we'll come with you. And he's just kind of like, oh, it's just, you know, like a real quick exam. You don't have to join him. And we're like, no, we'll come with you. I have no doubt in my mind that if they tried to take Isa, my husband, the police would have to show up. We go into this small room. Lo and behold, it is an eye exam. I'm standing next to Isa and Fahad is facing the door. We get ushered into room 3. Again, we don't know if there's someone waiting in the room. We don't know if we're going to be held in the room and someone's going to come find us. Thank God, the next person to walk through those doors is our neurologist. With her is a resident. I feel like I can trust these women. What I do also understand is, regardless of Isa's diagnosis, if one doctor has made a medical abuse accusation, our personal doctor has no power to protect us from him. Our neurologist tells us the accusing doctor had called her on the day of Isa's infusion. She was annoyed with him. She's like, this is not your patient. You don't need to get involved. She didn't answer his call. After that, he writes up his notes and puts the medical abuse accusation in there. The implication is he was pissed off. Maybe it was retaliatory. I don't know. Every parent should know this. Just because you have a diagnosis, you are not in the clear. 3 doctors made it clear that this child has autoimmune encephalitis. Those 3 doctors, they can't save us. An autistic child was taken from his parents in Texas. The doctor who had made the original accusation showed up to their first court appearance and said, I didn't intend for all of this to happen. I don't want this family to be separated. I do not think there is any imminent danger to this child. And the judge told her, respectfully, this is no longer in your hands. This is now in the court's hands. So I'm fully aware that even though So our neurologist, they're all on our side. It doesn't save us. Is there any recourse? Can we sue? There's literally a panel of lawyers whose job it is to protect the hospital. That is all they do, and they are very powerful. So the chances of you actually suing to get this removed from your chart is almost impossible. Every single doctor from this point forward is now going to believe this is a case of medical child abuse. We don't have a definitive diagnosis yet. There were no biomarkers for Issa's autoimmune encephalitis. He had a clinical diagnosis. We find out later the accusing doctor had shown up to the office on the day of Issa's appointment. He had never done that before. Our lawyer said, I don't know what God you pray to, but you should be thanking him right now. That doctor was poking around for something, and the fact that you walked out of there with your child, you need to be so grateful. He was poking around. It has become very clear to us, our lawyer, and our neurologist that bringing Issa back into the hospital system for IVIG is no longer a safe option. Now, our neurologist is working really hard to get Issa's medication approved for home health. During this time where we are going through rounds and rounds of insurance denials, because that's just what they do, Issa's hanging on by a thread.
Are you trying to roll over? Here, you want your tag?
Our neurologist is prescribing steroids and just trying to suppress his immune system as much as possible while we are trying to get IVIG approved, because we cannot go back to the hospital. She knows this. We know this. We also know that he desperately needs this medication or he is going to slip into psychosis and there will be irreparable damage. He descended into psychosis in January of 2021, and in October we finally get approval to proceed with monthly IVIG infusions. That is when Issa starts to turn the corner.
Got it. So the rook can only go X and Y axis. Axes. Okay.
Axes.
Oh, okay.
That is when he starts to stabilize. It takes 4 years of consistent immunotherapy for Issa to start feeling something like himself again. For those 4 years, he had crippling anxiety, debilitating OCD, paranoia, occasional hallucinations. Every time he was exposed to any sort of infectious trigger, the symptoms would come back with a vengeance and he would need to be put on steroids as well. In 2025, Issa went back to school full time. We are so proud of him. He's in AP classes. He speaks multiple languages. He wants to travel abroad. He wants to go to university in Germany. He has so many dreams because one doctor went against her colleagues and she was curious and courageous enough. She believed me. She believed us. And the child that was once in psychosis, who could not recognize me, is now helping me write his story. And when I ask him what he remembers, tragically, he remembers all of it. He remembers the hallucinations. He remembers them vividly. But when I ask him what the worst part of it was, what was the most traumatizing part, without hesitation, he says, it was not being believed. It was when he said to me, I wish I just had cancer, because at least then they would believe me. The fact that my child wishes for cancer so that he can be saved from the trauma of not being believed when he was so desperately sick is an indictment of the entire healthcare system, and I will forever be pissed off about it. I started writing my memoir because I wanted to let go of the anger that I felt at the way my son's illness was handled. And as I wrote, I just got angrier and angrier. The way that the system handled a child who had his entire life ahead of him with such reckless disregard is disgusting.